today's topic is obsessive-compulsive disorder. If you can tell from the title, it's when someone gets obsessed with a thought or an action, and he does it over excessively, like where it becomes a problem. So obsessive-compulsive disorder, OCD, is a mental illness that causes repetitive, unwanted thoughts or sensations, or the urge to do something over and over again, which is compulsion. Some people can have both obsessions and compulsions. So what usually happens is that you have an obsessive thought in your mind, and due to that obsessive thought, you have an action to help defeat the anxiety of this thought. I'll be talking more in depth about this shortly. Okay, so OCD isn't about habits like the normal everyday habit. It's way out of proportion. Like normal habits would be biting your nails, or just the normal negative thoughts that everybody goes through. These are normal habits that every person has. An obsessive thought might be like thinking that a certain color is bad, like, oh, the green is really bad, and you just can't stop thinking about it. And that's an obsessive thought. A compulsive habit, an example of a compulsive habit that's considered from OCDs is washing your hands 7 times a day after something that could be dirty. It's just the overextent of it. It's the thing that's really bad. Although you may not want to think or do these things, you feel powerless to stop. You just can't stop thinking or can't stop doing this thing. Okay, so what really differs a habit from an OCD action is if the OCD action takes up at least an hour a day. The OCD action is beyond your control. You cannot control it. There's no way. Like for example, biting your nails. You could, with your own willpower, stop biting your nails. In OCD actions, it's not possible. You have no control over it. It's a mental disorder. You have no control over it. OCD actions are not enjoyable. They might reduce your anxiety through thinking through the compulsions, but they aren't enjoyable. Biting your nails, some people think it's enjoyable, so they do it. Compulsive habits are not enjoyable, and if the habits interfere with your everyday life, these are the things that differ OCD from normal everyday habits in everyday lives. So OCD comes in many forms. There's like different types, or there's forms that you could separate OCD actions into. The first form is checking. You always check on something, such as locks, alarm systems, ovens, light switches, or think you have medical conditions like pregnancy or schizophrenia. So it's just the thought of it, and you just check for it every minute, and you're just so obsessed with the thought that you can't stop. You can't stop thinking about it. Contaminations as well. It's like you're always thinking about that you're dirty, and you have the compulsion to always clean yourself. I think that OCD is related to phobias in a type of way in which you're like afraid of something. So they really run on parallels. So yeah, phobias and OCDs might be related. Symmetry and ordering. Have you guys ever seen a person where like how can I say this? If something is off the symmetrical being by just like a centimeter, they just get nervous for some reason. There's these types of people that always have that feeling. Ruminations or intrusive thoughts. Just you have weird thoughts in your mind and you can't stop thinking about it. Sometimes it's violent and disturbing. So these are the type of things that happen. All right. Okay. Options are repeated, persistent, and unwanted thoughts, urges, or images that are intrusive and cause distress or anxiety. You might try to ignore them or get rid of them by performing a compulsive behavior or ritual. So obsessions and compulsions, they really work hand on hand. They might be separate things, but they can be related. These obsessions typically intrude with what you're trying to think or do other things. So it's really an intrusive thought that ruins your normal thinking process. That messes with your everyday life and everyday thinking rituals. Examples of obsessions might include fear of contaminations or dirt. You just can't handle being dirty. Doubting and having difficulty tolerating uncertainty. He always doubts what he's doing. In that case, it's an intrusive thought and an obsession. Needing things orderly and symmetrically. Yeah, there's, I don't know what it's called exactly, but there's the types of people that they just can't handle things being off the normal by a bit. If a notebook on the table is slightly tilted, they just get anxious for no reason. Aggressive or horrific thoughts about losing control and harming yourself. I'll play a video at the end of the presentation to show you an example of this specifically. Unwanted thoughts, including aggression or sexual or religious subjects. So just are really unwanted thoughts that you want to get rid of that you want to get rid of, but you can't. Your mind is always thinking about it. Compulsions. So compulsions are repetitive behavior that you feel driven to perform. You have no reason to do it, but you just do it because your mind is telling you to do it. It's like your mind is controlling you without you. I think, yeah. These repetitive behaviors or mental acts are meant to reduce anxiety related to your obsessions or prevent something bad from happening. So your mind is just either has a fear of something or is anxious and wants to get rid of it, so it does an action to hopefully fix the situation. However, engaging in the compulsion brings no pleasure and may offer a temporary relief from anxiety. So compulsions are just temporarily reliefs. Yeah. You may make up rules or rituals to follow that help control your anxiety when you're having an obsessive thoughts. What can an example of this be? Maybe you put yourself through a rule that after every 5 minutes you have to wash your hands because you feel that everything that you touch is dirty and you want to get rid of it. So the obsession is the obsessive thought is everything is dirty and you can't handle not being dirty. And the compulsion is you wash your hands every time because of the obsessive thought that you had. Just an example. Is everybody clear on that, or should I give one more example?
Yes. Clear.
All right. Examples of compulsion habits is washing and cleaning, as I just said. Checking. Maybe you're just so obsessed with your home safety, for example. So let's say you're a parent and you're obsessed with your home safety. And before you sleep at night, you check the doors and see if they're locked 5 times. You just go through all the doors 5 times and check that they're locked before sleep. That's an example of a compulsive habit. And don't know, you can't control it. It's only in your mind. No, your mind is telling your body, and you can't control it. Counting, maybe. Let's say you want to get a job done, and trying to think of an example. I think we skip that. Orderliness. Maybe if you're in your room and you just make sure that everything is tight, and you go through your room and fix everything 5 times during the day, and it takes a lot of time and effort to do it. That's an example of a compulsion. Following a strict routine. Following a strict routine, and you have no control of it, and you have no way of stopping it. Demanding reassurance. You just let's say that the obsessive thought that you have is maybe okay. Since we're on this topic, maybe you're afraid that you didn't submit your college application properly, and so you send in 5 emails to the university, checking if they have received your application or not. That could be a compulsion as well. Next slide. All right, what causes this obsession or this compulsion that you have, this disorder? What is the thing that causes you to have these ideas? So, as with other mental disorders, it's not still a mystical. I don't want to say mystical, but it's still not fully understood. The main theories that could possibly lead you to have OCD is if OCD may be a result of changes in your body's own natural chemistry or brain functions. I'll talk about that in the next slide. Genetics. OCD may have a genetic component, but specific genes have yet to be identified. I feel like at some point, doctors just put in genetics if they don't know the solution, but it actually makes sense that genetics is a cause of this, because it might be inherited from your parents. The chances are greater. Learning, where it's just you not after experiences or seeing people or people teaching you this stuff, you get obsessed with that thought. Obsessive fears and compulsion behaviors can be learned from watching family members or gradual learning over time. Let's say you watch a video on microscopic on germs eating up a skin, and after that you just get obsessed with the idea, you get obsessed with fear that these germs are eating up your skin as you live your day-to-day life, and that can form an obsession or a compulsion. Next slide. Shit, I forgot. I got used to Rayan flipping the slides. Okay. Researchers know that OCD is triggered by communication problems between the brain's deeper structures and the front part of the brain, which is the prefrontal cortex, if I'm not mistaken. These parts of the brain primarily use serotonin to communicate. Serotonin is the neurotransmitter that they use to communicate. This is why increasing the level of serotonin in the brain can help to alleviate OCD symptoms. However, even though researchers know that the low levels of serotonin can cause OCD symptoms, there is no laboratory test to diagnose OCD. So one of the main things that's is the communication between the cortex. So the serotonin neurotransmitters are not. There's low levels of serotonin, which causes the symptoms. So it's just the imbalance that really causes all these symptoms. And with medication, they could possibly raise the levels of serotonin, they can help alleviate the symptoms. Complications. Why is it bad? It's clear why it's bad, but things that may result in the cause of OCD disorder. OCD is a disorder. Excessive time engaging in ritualistic behavior, time doing things that have no purpose. Health issues such as contact dermatitis from frequent hand washing. Um, it's just a result of the actions that you do. Maybe you wash your hands too much and you get a skin disease, or you overwork yourself, don't get compulsion, and you get tired and end up with problems. Difficulty attending work, school, or school activities. Just interference in everyday life. Troubled relationships. Sometimes the thoughts can ruin a relationship in some cases. Overall poor quality of life, suicidal thoughts and behaviors. Just want to get rid of them, but you can't. So you end up having suicidal thoughts. What puts you at risk of OCD? A parent, sibling, or child with OCD. Differences in certain parts of your brain. Depression, anxiety, or tics. Experience with trauma. A history of abuse as a child. Experience with trauma. We'll talk about more in depth tomorrow in complete grief disorder. And see exactly what happens. Possible treatment for OCD. There's no specific cure for OCD, but you may be able to manage your symptoms that affect your life through medicine, therapy, or a combination of treatment. The first thing, this applies to a lot of mental diseases. Therapy, cognitive behavioral therapy, changing the way you think, and you just learn how to stop the help many people control obsessions and compulsions. If you still have symptoms, your doctor might give you antipsychotic drugs. Well, as I said before, the main problem that happens in the brain is that there's the serotonin levels are low, so they help regain the serotonin levels and increase it. Neuromodulation. In rare cases when therapy and medication aren't making enough of a difference. So these two things are severe, and medication and therapy are not doing their. Your doctor might talk to you about the devices that change the electrical activity in a certain area of your brain. It uses magnetic field to stimulate nerve cells. So we took about the TMS. There's certain devices or surgery that modify the electric activity in the brain and help in possibly situation. So there's no sure way to prevent it. However, getting treated as soon as possible may help of it getting worse.